The incident we are addressing today was not only an attack on our hospitals. This attack was on our region, our healthcare system that affects all of us. We made the difficult decision to not pay ransom to criminals. And as retribution, they published data about our staff and our patients. We understand the public's need for more information about this incident, and we are committed to transparency. We have provided regular updates on restoration of services and the data affected. We know that some of you want to hear more. We also must be careful. This is an active incident. The perpetrators of this attack may still attempt to harm us further. So, as we emerge from this, we are focused on sharing the information required to safely resume care for our patients and inform those whose data is affected. Here at Blue Water Health in Sarnia and Petrolia, these past few weeks have truly tested us, along with our regional partners. It's been a challenging path, and I am so grateful to be surrounded by an incredible team. The employees, professional staff, and volunteers, they've all shown remarkable teamwork, innovation, strength, and dedication. The fact that this attack targeted a healthcare facility on the heels of a hard-fought pandemic is sickening. I want to acknowledge how unsettling it must be for our patients to have their personal health information compromised, and I sincerely apologize for the concern this has raised. As we previously disclosed, the attackers targeted a Blue Water Health database report, including information of all of our Blue Water Health patients and its predecessor hospital since 1992. They also stole other data that is still being analyzed. Blue Water Health has now begun the process of notifying a group of approximately 20,000 patients whose social insurance numbers were compromised during the attack and providing them with 2 years of free credit monitoring. The details of this rollout have been publicly distributed this morning with an ongoing plan to spread our communication efforts. Without access to our vital digital systems, there has been an impact on our families and patients' experience, sometimes resulting in canceled appointments. Our staff have been doing their very best to provide advance notice, and unfortunately, in some instances, the notification has not occurred until the time the patient has arrived. And again, we apologize for this inconvenience. While we are working hard to maintain regular services, some heavily impacted areas like diagnostic imaging and lab have had to prioritize urgent and emergent needs. Our labs in Sarnia and Petrolia are deferring non-urgent walk-in appointments. In our diagnostic and imaging department, where we are prioritizing emergency and inpatient cases, has had to cancel over 3,500 appointments, causing a significant and growing backlog. In some instances where physicians don't have access to important information, the physicians have chosen to reschedule a procedure. However, no urgent or emergent cases have been canceled. Amazingly, amidst this attack, our hospital continues to live our purpose statement: health through partnership and caring with kindness. We've partnered with our patients, families, colleagues, primary care, and community partners to keep safe, quality care our priority over the past 4 weeks. As we move forward, our focus remains on restoring and fortifying our systems, nurturing the resilience of our teams, and ensuring our community continues to receive the care and information they need. We're all eager to return to full operations for Sarnia-Lambton. The support of our patients, families, and Blue Water Health team, including our board of directors, our community at large, is so greatly appreciated now and throughout this restoration period. With that, I extend my sincere and heartfelt thank you.
Thank you, Paula. I will now pass it over to Lori Marshall, President and CEO from Chatham-Kent Health Alliance.
Thank you, Fanny. And good morning, everyone. I want to begin today on behalf of the Board of Directors of Chatham-Kent Health Alliance and myself to thank everyone in our organization and our community. Our staff, physicians, and volunteers have displayed an unwavering commitment to safe, high-quality care during this challenging time. In times of crisis, Team CKHA always displays a remarkable resilience, and they continue to provide patient and family-centered care for our community. I'm extremely proud of them for their tireless working to provide exceptional care to patients, even during the most challenging times. On behalf of everyone at CKHA, I also want to extend a heartfelt thank you to the Chatham-Kent community for your patience, your understanding, and most importantly, your support to us. We know this has been very challenging for many patients and families and understand the hardship that it has caused. Please know that we are working diligently to get our systems back up safely and securely. I want to spend a little bit of time talking about the restoration efforts. These are regionally coordinated and prioritized, and then locally executed. Prior to the restoration efforts beginning, we had to secure our environment and establish a clear and safe platform. These activities were initiated by our information system partner as soon as the cyber attack was confirmed, and these are ongoing. From a systems perspective, restorations efforts have included a review of each system in the regional ecosystem to review whether or not the server was impacted, and if it was, following a series of steps to ensure that it is backed up, restored, scanned, repaired, and placed behind a new firewall. Bringing the system back up is a phased, prioritized approach, with critical patient systems being the first priority for all of us, and that will be up by mid-December. The balance of systems will be prioritized and a plan for each created as part of the next phases of restoration. A strategic process is in development with operational leadership to backload and scan all patient information during the downtime ahead of bringing the system back up live. I would like to address the specifics with respect to the employee information that was stolen from CKHA. We did confirm the theft of an employee database report containing information about 1,446 individuals who are employed at Chatham-Kent Health Alliance as of February 2nd, 2021. And we know that for those individuals employed on that date, the information that was stolen included the name, address, social insurance number, gender, marital status, date of birth, and basic pay rate. The database report did not appear to include any of our professional staff or volunteers, and no banking information was stolen. Staff will be notified by the end of this week and early next week, particularly for those who no longer work at CKHA if they have been affected by this stolen data. With respect to patient care in our community, in the first few days, a number of planned surgeries and procedures and ambulatory visits were rescheduled as we assessed our situation. We've since returned to much more normal volumes in those areas. We've continued to provide outpatient and ambulatory care, although at this stage, because we are a satellite clinic of London's oncology program, we are deferring new chemotherapy patients until our critical systems are back up. These patients will be transitioned from London to Chatham as soon as possible. Our diagnostic imaging service is focused on priority patients, and we're currently depending on our community partners for imaging for walk-in services. Imaging required for cancer patients has also been sent to London Health Sciences Centre. The most significant impact to us has been our limitations with respect to our ability to provide stroke care for patients who must bypass Chatham-Kent Health Alliance. Patients experiencing stroke symptoms in the community are being transported to London Health Sciences Centre or Windsor Regional Hospital via our local EMS for emergent stroke care. We take our role very seriously for the care that we have not been able to provide during this cyber attack. Our patients have always been our first priority and will continue to be. In times like these, it is easy to feel overwhelmed and frustrated and vulnerable. The impact of the cyber attack extends far beyond the digital realm, and when it affects an institution like a hospital, we know that it has real life impacts. We understand that this incident has disrupted not only our daily lives, but also our sense of security and trust. We're committed to restoring normalcy, enhancing our cybersecurity measures, and ensuring the safety of our patients, staff, physicians, and volunteers. Thank you.
Thank you, Lori. I will now ask Kristen Kennedy, CEO from Erie Shores Healthcare, to share her remarks.
Thank you, Fanny, and good morning. As we navigate through the aftermath of the recent cyber attack on our hospital systems, I want to begin by expressing our hospital's profound gratitude to our patients and the public. Your understanding during this system outage has been invaluable. Your support has helped us maintain our focus on delivering quality care under challenging circumstances. Equally, our heartfelt thanks to all of our staff, volunteers, and physicians. Your hard work, dedication, and resilience during this period have been nothing short of inspirational. Despite these hurdles, you've continued to provide exceptional care and services, embodying the true spirit of our healthcare community. As we address this cyber attack, it's important to understand its impact on the operations at Erie Shores Healthcare. Our greatest impact is within our diagnostic imaging department. While X-rays and nuclear med tests continue, our ultrasound, CT scans, and mammograms, unfortunately, have had to be rescheduled, with some delays extending upwards of 6 weeks. We know this is not ideal, but we are committed to restoring to our full capacity. By the end of November, we anticipate our capacity will be near normal, with a full resumption of services projected by mid-December. The primary reason for the delays is the limited capacity for our radiologists to read all images. However, we are taking significant steps to mitigate this issue. A separate, robust system is being introduced to fill the current gap. Once we have full resumption of services, this system will provide redundancy, safeguarding our imaging services against similar disruptions in the future. Turning to our data breach aspect of the cyber attack, I want to assure everyone that we are handling this with the utmost seriousness and transparency. Our staff members whose data has been compromised have been notified either by phone or direct mail. This data breach affected approximately 350 current or previous staff. Their social insurance numbers and names were stolen from our systems. These individuals worked during a very specific two-time pay period, one in June of 2019 and one in January of 2020. We are offering credit monitoring services to these 350 impacted individuals as a precautionary measure. To date, these are the only employees to be identified who have been impacted by this criminal attack. We are continuing with the e-discovery process on the remaining data. Should we identify that our impacted individuals or other individuals, whether staff or patients, we will be notifying them directly and take appropriate steps to support them. It's important to note to date that we have not identified any banking information as part of the breach for our staff. In closing, I want to reiterate our commitment to resolving these challenges with due diligence and care. We are here for you, and we will emerge stronger and more resilient from this experience. Thank you.
Thank you, Kristen. I will now pass it over to Bill Mara, President and CEO with Hotel Dieu Grace Healthcare.
Thank you, Fanny, and good morning to everyone. On behalf of the Hotel Dieu Grace Board of Directors and our senior leadership team, I would like to take this opportunity to firstly extend our gratitude to all of our physicians, our frontline nursing staff, our allied health teams, our offsite social workers, counselors, nurses, and our entire frontline colleagues, including individuals from environmental services, facilities, security, food and nutrition, for their patience, their perseverance through what has once again proven to be a very challenging set of circumstances. I want to personally acknowledge our back office teams, including human resources, occupational health and safety, payroll, finance, health information management, decision support, and our communications teams for their unwavering efforts. Over the past 3 weeks or so, we have focused on ensuring that we continue to offer programs and services at our hospital to meet the needs of our patients and our clients, and also to provide a safe working environment for our people. We have worked very closely with the entire group of hospital CEOs from our region, ensuring that we can continue to accommodate transfers, admissions, and discharges to mitigate the impact on patient flow and occupancy levels in our hospital system. As we continue to work through this criminal act, our teams are focused on restoring systems and investigating any further data impacts. At this time, we have not identified any further data impacts specific to our hospital outside of what has been communicated to date. To reiterate our statement from November 9th, we can confirm the theft of an employee database. It was a report containing information of 1,396 individuals employed by Hotel Dieu Grace Healthcare as of November 4th, 2022. That included 151 former employees. If you were employed by Hotel Dieu Grace Healthcare on that date, we believe that your data was taken. That will include your full name, social insurance number, and basic rate of pay. This database report does not appear to include professional staff or volunteers. I also want to emphasize that no banking information was stolen. We will continue to distribute complimentary credit monitoring, and all individuals affected by this specific theft of data will also be receiving a letter in the mail. Now, throughout this time, our primary goals have been to contain the crisis, focus on restoration, and then from there proceed with the post-event circumstances, which include, but are not limited to, any recommendations from any and all investigations. From the very moment that we were made aware of the cyber attack, collectively, our primary focus has been the protection of our people, our patients, and our clients, and everyone we serve. Every decision made, every circumstance that has been contemplated, we were always underscored by those fundamental priorities and those principles. Our resiliency has been once again tested by way of a crisis, and once again, we've demonstrated that we put our people, our patients, our clients, and our community first. Thank you.
Thank you, Bill. I will now ask David Mouche, CEO from Windsor Regional Hospital, to share his remarks.
Thank you, Fanny, and good morning, everybody. I'm not going to repeat what I stated a couple weeks ago at our hospital board meeting or what my colleagues share. However, I truly need to stress something about our Windsor Regional Hospital team, who once again I cannot be prouder of. The WRH team has had one focus since this criminal cyber attack has occurred, and that is our patients. For those organizations and individuals in Windsor, across Canada and the world that have been subject to a criminal cyber attack, they understand that you are dealing with a different type of criminal. You are not dealing with your petty theft type of criminals, but a sophisticated gang of individuals who have an ultimate goal of hurting people for money. Canadian experts who immediately started to support us in addressing all of our issues have been through this, unfortunately, hundreds of times. Their clear advice is the last thing you want to do is poke the bear, or as someone told me recently, you should never get into an argument with a skunk. As a result, we want these criminal actors to go away to minimize the damage to our patient, staff, and community. It is horrible one patient or one staff member was impacted by this criminal act. However, we do not want to cause more damage to them than has already been caused. In light of these concerns that have been shared to us by these experts, We have been and will continue to be forthcoming with the information we have access to and to avoid at all costs poking the bear. We appreciate our community's understanding the situation we're in, that we're responding to a crime that has international police authorities involved, but with a clear focus now on our patients and community. What we do hope is one outcome for this is for governments to mandate that no ransom payment position. This was recently endorsed by Canada and 49 other countries as part of the International Counter Ransomware Initiative. Paying ransom only perpetuates this issue from reoccurring to others and feeds this monster. Thank you, everybody.